important day for Central LHIN. We're starting a journey. It's the first step, and it's a journey we want to be on that's going to lead us to the creation of what we're calling a consumer scorecard. A tool that's going to help us understand the experience patients are having with our local healthcare system. But the next step in improving quality has to come from the patients themselves, and it needs to center on their experience in our healthcare system. So currently, we do not have a consistent mechanism that we can use to understand and assess, measure patient experience across our local healthcare system. And we'd like that to change. And we'd like to be able to benchmark and monitor patient experience in the LHIN so that we can see if we, as key system stakeholders, providers, planners, funders, are making a difference, making progress in the eyes of the patient.
We sometimes shoot in the dark, our arrows. We need clear definition, and so what we believe from the Institute perspective is that without definition there's no basis for action, and we have to define what the patient experience is for us. Because at the end of the day, no matter how great we think we're doing, if we're deliverers of care, those of us in the room, the patient's perception is what ultimately matters. We're moving beyond just the concept of patient to patient as consumer. And that simply comes back down to one idea, right? As consumers, we have choice. The influence of personal experiences and peer recommendations, in particular in healthcare above all else, makes the biggest difference. Because you chose to treat me as a human being, I choose to use you for my healthcare. And ultimately, the fact is that patient experience is there at all times. It doesn't stop. So when we think about it, and I encourage you, and I know this is the great work that you're framing today, that this isn't about just something you're going to go do over here. It is what you do every day in every aspect of the healthcare system. At the end of the day, it really is just simply human beings caring for human beings.
Start at least moving rounds to the bedside. We got to be patient-centered. We got to talk about the patient. When we get together, we need to talk about the patient and make sure the patient is really incorporated in what we talk about. And then what we said, it's not good enough to be patient-centered. They actually have to be engaged, and that's really where a lot of us are now, is starting to actually have the patients involved. Any good movement and any good change in any part of the world is nothing without leadership. Until we can actually, if we really want to be continually improving, part of continually improving is admitting where we're not there yet. And that means being able to get to a place where a culture of failure is part of what we're comfortable with and we can have open discussions about.
There are three aspirations that people have. The safety aspiration, don't harm me. When I'm interacting with you in your facility or in your healthcare organizations, it is important to me that I'm not harmed. The patient safety issue. Make me better or heal me, the clinical effectiveness. If I've come in with a condition, please heal me. Interact with me so that that thing gets addressed, that clinical issue. And then be nice to me, the service orientation. And as Jason says, the integration of all of that constitutes what we deem to be the patient experience. So it really is the quality of care as it is perceived by the person receiving that care. Actually, now there is evidence to support that patient experience is tied to clinical system and cost outcomes. For those people who think of it as a soft area or not an area to pay attention to, it matters to the hardcore measures that we feel are important.
As we wrap up today, I think we made some clear progress. We made a lot of progress towards understanding best practices related to the patient experience. I hope you'll agree that some strong ideas have come out of our workshop, and I'm excited to follow the evolution. We are at day one at this process, and it's terrific.